To welcome everyone to our virtual trustee forum this September 10th. And thank you again for your interest in being here. And this is a great opportunity to learn about and be involved in what is going to proceed in our upcoming Michigan Dental Association Board of Trustees meeting, and to have involvement in what's going to be discussed, and certainly have your opinions and questions answered. We have a good agenda tonight, and I would like to thank our members. Of course, I will be speaking, followed by Ms. Karen Burgess, also Dr. Chris Smiley, Dr. Vince Lizio, Dr. Bob Richards, Dr. Melanie Mayberry, and then Karen and I will follow that with a couple of other secondary topics thereafter. And of course, there will be time for questions at the end, and I will ask everyone to please make sure your questions are being answered in our chat function here. And then also, if there was a particular speaker or person you think may be appropriate toward that subject. And so I am going to start our discussion, and just to give a little bit overview about one of our areas, which is our generative discussion. And as most of us know, new member engagement is a constant challenge, and especially in these times where all of us know that our newer generation of dentists have additional burdens that some of us may not have quite had the exact same impact relative to the cost of tuition and competition for funding and membership ideas and what have you. And so the MDA is committed to looking at how do we capture the most amount of membership, and particularly that we are evolving and that we are adapting to the needs of all of our members, including our newest members. And so our generative discussion, which is an opportunity for the board to really have an open dialogue, to look at ideas and different ways of thinking, include this in particular, our generative discussion format during the meeting. And the topic at this generative discussion is going to be to bring new ideas for engaging our new dentists, as well as demonstrating value. And so we know, regardless of what things cost, if we can prove that there's value, then certainly that is going to be an opportunity to be a member if we see value in paying in being involved as a member. So we're going to have a focus on that. We have also we have invited several of our newer dentists, I should say, and to have this discussion. And we look forward to some good topics and some good discussions, and looking for new ideas and how to make sure we maximize our membership penetration, which is very important, especially during these pandemic times. We know everything is a challenge financially, and we have to make sure the MDA remains strong and that we maintain excellent member value and really keep our percent of members at its maximum. And as a state dental association, we really do a good job. We take pride in that. The staff works exceptionally hard to keep our numbers at some of the highest in the country. And so these are the ways that we go about that. With that being said, I would like to pass the baton to Ms. Karen Burgess, who is going to talk about our membership update.
Thank you, Steve, and thanks everybody for being with us. I see we have 29 participants tonight, so that's an excellent turnout and very gratifying to see. It's interesting that Steve has commented about the importance of new dentists, because our membership update that I have for you today shows that new dentists are actually a higher percentage of our membership than they have been in the past. The number of new graduates or people who've been out of school less than 10 years is at this point on the uptick with the larger class sizes. And then the number of retirements that we've seen as the baby boomers are getting up there in age, and I'm a boomer, so I can say that. We're seeing an increase in retirements, particularly this year. I've noticed an uptick. So the board will be receiving a very detailed report on 2020 membership as well as the trends. And they'll also be learning about the membership recruitment and retention initiatives that the MDA undertakes on an ongoing basis. Included in this is our outreach to the dental schools and the dental students, and conversion of new graduates to active membership. So right now, the Michigan Dental Association has a membership market share, meaning that the percentage of people who are eligible for active membership who actually are active members is 73.6%. This is down about 0.1% compared to this time last year when we were at 73.7. And what we find over the course of the next few months is that there is the opportunity, and what we typically see is pretty significant growth in the number of members as the class of 2020 transitions to active membership. And in addition, we undertake our Rate 8 recruitment campaign. And for those who don't know, because Rate 8 is kind of inside baseball talk, it's our quarter year campaign. Any non-member is eligible to get 3 months of membership from October 1st to December 31st at no cost, but you only get this one time in your life. So every year we will get anywhere from 25 to 55 people typically who take the opportunity to join at the quarter year rate, and then they get their invoice, and typically we will see the vast majority of those individuals who have done the quarter year rate will renew their membership for the following year. So it's a great opportunity to kind of pull in some people who are interested, but the writing of the check might be a little bit of a barrier. So that's a good opportunity for us. Looking at this year, I think you all know that the pandemic, you would expect, would wreak havoc on membership numbers, but actually that's not the case. And the reason for that is that the vast majority of our members do pay their dues on time or within, the first couple months after the start of the year. So right now, active non-renews are only about 16 people more than they were last year at this time. And total membership in terms of our raw numbers is down by about 101. This, as I pointed out, is primarily due to some contraction in the market as we have had people age out of active membership and move into retirement. From a membership subgroup standpoint, we're seeing our membership becoming more diverse from the standpoint of racial ethnic diversity. We've got a larger number of people who are of a diverse background who are MDA members. And we've also seen growth in the number of women compared to the number of men. And of course, this reflects the demographics of the profession as a whole is becoming more female, younger, and more diverse. So looking forward to 2021, I will tell you that we are feeling a bit of uncertainty associated with this because as a result of the pandemic, we've seen many people who've been under some pretty significant financial pressure, although thankfully it does appear that dentistry in Michigan is rebounding very nicely. But we also have the situation where the American Dental Association will be changing their dues rates. They had approved this a year or two ago. And so active life members who for us pay 50% of dues and the assessment at the ADA level will be going from paying 75% of ADA dues to 100%. So you can see that's a dues increase for a pretty significant number of people. And then we also have, on the other end, our new dentists who had previously had a 4-year reduced dues program are now going to be transitioning to just a 2-year program where it goes from 0 to 50% to 100%. And as a result, we'll be seeing our younger dentists having the need to write a bigger check because of the increase in the ADA dues. So as a result of that, we are undertaking kind of a member value campaign that we're trying to showcase to those 2 target markets specifically that the value of organized dentistry and of the MDA in particular, because we want to minimize any loss from those groups. So that being said, I try to keep it short, but I love this topic, so I will stop here and move on to Dr. Christopher Smiley talking about the Board of Dentistry administrative rules.
Thank you, Karen. So at the Board of Dentistry, they are currently in the process of reviewing a broad spectrum of administrative rules. And as you may know, we have a work group that has been dealing with delegation of duties to allied professionals, the assistants, RDAs, CDAs, and also to hygienists. For example, we've taken a look at and provided comment on a whole chart of delegation changes or editorial changes that the MDA has voiced to the public comments that are going on at LARA currently. Some of those include things like delegation of impressions for final restorations or intraoral appliances, updating that to talk about scans and scanning, not just impressions. We're not the only group, obviously, that is making comment. You have the assisting and hygiene societies who are making comment, but also general public can make comment. And it's going through September. I'm thinking, Karen, you may correct me if I'm wrong, but something like September 18th is when the comment period is going to be drawing to a close. Also, another area that we're seeing as far as administrative rules and where the MDA has commented has to do with the dental therapist. Now, the agreement that was put forward when the dental therapist was approved says that a dental therapist may supervise no more than 3 dental assistants or registered dental assistants and 2 registered dental hygienists in any one health setting as allowed in the written practice agreement. The practice agreement must define the type of supervision required by the dental therapist. So in defining that type of supervision, in order to avoid having the possibility of dental therapists be given greater authority to delegate duties beyond what the dentist is able to do, CGIA has brought forth comment that dental therapists cannot delegate duties to allied dental personnel beyond the delegation of duties that is allowed by a dentist. So the resolution that we have before us on that is that the MDA recommends that the state administrative rules on dentistry be amended to limit the level of supervision dental therapists have over dental personnel to the same level dentists have. So that's a couple of the issues of the comments. There's much more that will be in the board report as far as all the comments that we have offered to LARA. But that's what's going on in that regard. So that said, I'd like to introduce Vince Lizio, who's going to talk to us at first about tax relief for COVID-19 expenses. Vince?
Well, thank you, Dr. Smiley. So thank you everyone for joining tonight. I've got 2 topics tonight covering things from the Committee of Government and Insurance Affairs. Pretty much both are all on the consent calendar as of now. First thing I'd like to do is, mention that, these things that we kind of get in touch with and all the important information we get, we have a great team at the MDA, Bill Sullivan and Josh Kluzak, who have done a great job keeping us informed. and letting us know what's going on and just trying to keep us in the loop with what's going on in the government things. So one of the things, I'm going to screen share so you don't have to stare at me all the time. There we go. I'm going to cover COVID first, which is there's a couple bills right now in the House. There's 630 and 631 that are basically involved with limiting liability for employers regarding to COVID. So basically, one is civil and one is kind of legal or statutory. So they go through. Basically, you can read, I kind of highlighted here, if you can see that employer operating in substantial compliance or reasonably consistent with a federal or state statute, regulation, executive order, public health guidance that was relevant to and applicable to the time of exposure. Basically, your liability is limited. Obviously, we support this as a group. 6032 is a little bit different. That's kind of trying to put into employment practices some laws that would limit how you can approach employers as far as and going through if they don't want to come to work or if there's problems coming to work. So right now we agree with the basis of 6032, but we don't want to put that in law. So basically what we had in kind of going through, let's see if I can slide it down so you can see, is that resolved that the MDA supports COVID-19 employer liability protection when the employer operates in substantial compliance with a federal statute or regulation, executive order, and further that we oppose 6032. So, which I'm going through. So that's pretty much the straight thing. I mean, good things. You still have to be in compliance. We still have to kind of go through doing those things, but it's something that is definitely going to be a good for us. The other thing that's going through now, and actually you probably hear it in Washington, the same thing, that there was talk about tax relief or relief for people who have expenses to handle COVID, the financial impact. So we've got 3 of them. These bills are in the House right now, basically all covering like some tax credit, not charging sales taxes for PPE and things like that, and things that you need to do in order to get your offices up to code. So basically, we think that's great. No opposition there. We'll discuss it, whether it's going to pass or anything go. But we just move that we support tax relief. So basically, pretty straightforward. They're on the consent calendar. But if there are questions or concerns or people that think that I'm sure we'd love to have more, and we'll continue to fight for more and talk about more. But other than that, they're pretty straightforward. So having said that, I'm going to pass it to Dr. Bob Richards. He's going to talk a little bit about dentistry as essential healthcare. Thank you.
Thanks, Dr. Lizio. I'm going to talk very briefly about the change in policy that the American Dental Association recently undertook, and basically stating that the dentist is going to be defined as an essential healthcare worker. The purpose of the policy was to ensure that if there is a resurgence of COVID and the states or any state goes back into closing parts of the economy, that dental practices would be allowed to stay open because it would be defined as an essential healthcare worker, as they do provide essential services. And it would also help us out in getting essential PPE that are required to provide essential services. There's just a few bullet points that the American Dental Association had. And basically what the MDA wants to do is to join in with the ADA and adopt the same policy. They state that oral health care is an integral component of systemic health. Dentistry is an essential healthcare service because of its role in evaluating, diagnosing, preventing, and treating oral disease, which can affect systemic health. The term essential dental care can be defined as any care that prevents, eliminates infection, preserves the structure and function of teeth, as well as orofacial, hard and soft tissue, and that this term be used in lieu of terms instead of emergency dental care or elective dental care, which we've had to deal with in the recent past. When communicating with legislators, that would be the definition, is essential. And by defining that, we would continue to deliver anything that's during a global pandemic or even a disaster situation. The fourth one is the government agencies such as Department of Homeland Security, the Federal Emergency Management Agency, that we acknowledge to them that essential care is needed to maintain the health of Americans so that they can sustain their health and livelihoods and live resiliently during the COVID-19 pandemic response. State agencies or officials are urged to recognize that oral health workforces, when designated its essential workforce during public health emergencies, in order to assist them to protect the health of their constituents. So the proposal will be coming forth to add this interim policy for the Michigan Dental Association. And if the American Dental Association adopts this as their permanent definition, the Michigan Dental Association would adopt it also. That's pretty much it in a nutshell. So I will pass the baton on to Dr. Melanie Mayberry. So Melanie, it's all yours.
Thanks, Dr. Richards. I'm going to talk about Senate Bill 281. This is a bill that is sponsored by Senator Pete McGregor. And this bill would amend the Public Health Code to require the Michigan Department of Licensing and Regulatory Affairs to report the name of a licensee or a registrant to law enforcement if Laura believed that there was reasonable basis to believe that a licensee or a registrant committed sexual misconduct. As I said, it was introduced by the senator. It has passed the Senate, and it currently is in the House Health Policy Committee. This is a bill that the Michigan Dental Association is in support of. There's another organization that has also been supportive of this bill as well, and that is the Michigan State Medical Society. And so that's a brief synopsis of what's happening as it relates to sexual misconduct and the Michigan Department of Licensing and Regulatory Affairs. I'll turn it over now to Ms. Burgess.
Thank you, Melanie. Yes, I'm going to give you a update on the 2021 budget. You know, the Board of Trustees is seeing from the Committee on Finance a first draft of the 2021 budget. And after they discuss it on September 18th, it will subsequently go to the House of Delegates for comment as usual. The process this year was a little expanded and protracted because of the financial uncertainty associated with the pandemic. The Committee on Finance has developed a very conservative budget. The budget they put forward is about 12% smaller than our 2020 budget. And that is due primarily to some expected reductions in revenue. Now, we don't expect these revenue reductions to be forever. It's generally non-dues revenue associated with continuing education related to the inability to hold in-person meetings for at least a portion of the 2021 year. In addition, we expect that there may be some reductions in royalty revenue as a result of the decreased level of patient care that has been given in 2020 that may continue to some degree into 2021. So the plan on the part of the Committee on Finance is to do a tight conservative budget so that any budget surprises that happen in 2021 will all be happy surprises. That's the plan. We're also planning, unfortunately, for a greater number than usual of non-renews. You know, demographically, we typically see a loss of anywhere from 50 to maybe 100 or so full dues payers. And that can be due to either moving into another category that pays less, like active life or retirees, or could be just from some people who decide that they want to drop out of membership for a period of time. So typically we see anywhere around 100. It can be as low as a lower number, and I've seen it as high as 150. So this year we're actually planning for around 200, just to be very conservative. We don't intend to have any impact on member service or member resources. In fact, we expect to see those continue to expand in 2021. But in order to bring forward a balanced budget, the Committee on Finance is recommending a 1-year reduction in the amount that members pay for the special assessment for the public awareness campaign of $100 to be used then to fund a $100 increase in dues. So the result will be less money going to the public awareness campaign, more money going into the general fund where it can be used for member service. And then, and yet for the members, what you will see on your bottom line is no change to your bottom line. So the check that the members write will not be higher. We expect this to be a 1-year only thing, a temporary thing. But we're looking forward to the board having the opportunity to evaluate the budget in detail, look at every department, look at every expense, look at every revenue, review it, and make any changes or tweaks that they would like to see to that first draft budget. Then, as I said, it will go to the House for comment, as it always does. And any of you who receive it will be welcome to communicate with Dr. Eric Knudsen, our treasurer, any suggestions that you may have for improvement or any comments that you have on the budget. So that is budget info. If you have specific questions about any of this after the next comment period, we can put them into the Q&A for questions and answers. So Dr. Mera, implicit bias training, I know that's the next topic on the agenda.
Thanks, Karen. So in the portion under the Committee on Government Insurance Affairs board report covers implicit bias training. And on July 9th, Governor Whitmer issued Executive Directive 2020-7, which is entitled Improving Equity in the Delivery of Healthcare. This order directs the Department of Licensing and Regulatory Affairs, LARA, to develop rules to establish implicit bias training standards for all health providers in Michigan, including dentists, not just dentists, all medical providers, health providers, but including us. And it further states that this training must be taken in order to get or renew a professional health license. So they put together an advisory work group to solicit comments from stakeholders in licensing of health professionals. And the MDA is participating in this. We have multiple board members as well as staff going to comment on this. You know, we have received comments, you know, and as an association with many members, we have folks that are very supportive of this, and we have also had folks that don't want to have another, you know, something else on their licensing. So we're going for comments again. You know, I think some people think that we tell the governor what to do. That's not the case. But as your association committed to member success, we are participating, we are monitoring, and in our position has been to advocate similar to human trafficking, that it is something that perhaps we do as a one-time sort of training. However, again, it's still in comment, and we have next week opportunities for a couple of our board members that are going to be at this task force meeting as well. So to be seen, and that is where we're at with implicit bias training at this time. I would like to move toward questions. I know some of you have been eagerly waiting and have some concerns regarding all of these areas, and please make sure guests that are on our call here enter the chat function, and I'll try to take questions in order.
So Dr. Mera,
Yep.
Perhaps people are not finding the chat function. It's at the bottom. If you're on a computer, it's at the bottom of your screen. So you would just open it up and type in there.
Yes, look at the bottom of the screen, as Karen mentioned, and it is bottom chat function, and it will allow you to enter a question. And again, if you would not mind, if there is a particular person you'd like to direct a question to, or if in general, I will try to.
Well, perhaps we anticipated questions that we're not actually getting.
I guess so. I guess that means that we're very thorough, and everyone has everything answered that that they need to. I'll give just a moment in case someone is a slow typer here. But please, we definitely appreciate everyone being on our meeting this evening and having an opportunity to participate. Oh, we have a question here from Dr. Chris Korecki. Has a deadline been established for the implicit bias training? Karen, I believe that it has not been, because it's not been finalized. Am I correct in that?
Yeah, I went to the first meeting of the stakeholder group where they were taking comments, and at that meeting that was held by Zoom, there were, I think, 111 people there. And at that point in time, the question was asked about the time frame, and they said that doing something like this typically might take 12 to 24 months, but because this is seen as a priority item, they expect it will take a minimum of 9 to 12 months before they have before they have a structure that they want to bring forward. And they are doing things like benchmarking what is being done in other states and looking at various options. So they appear to be wanting to do a thorough job and get a program that will accomplish the goal. But that's about the most I can say about it. It was very much a preliminary meeting, but it was 9 to 12 months.
Thank you, Karen. I actually have a couple of other comments here and questions in the chat function. Dr. Jeff Grabiel from Oakland says, do you want us to address this issue? I really don't know what that means. Did you have a question specifically? But please, if you wouldn't mind just being a little more specific. In which particular issue? Thank you.
I think he has to unmute.
You need to unmute yourself, please.
All right, can you hear me now?
Yep, we sure can.
Yes, we can.
All right, so this has been this whole issue, when I saw it come up, I talked to some friends. They said, just suck it up and just take the class. No one's going to pay any attention to it anyway.
Jeff, just for everyone's benefit, are you talking about the implicit bias training?
Yes, implicit
Okay,
bias
thank
training.
you. Just to be clear, thank you.
All right, so like I said, first of all, I have no problem with the data showing the disparate adversity between COVID and the minority community in Detroit. It really is true, and there's many reasons why it exists. But when I saw Gretchen Whitmer, I do have a problem with her assuming that racial bias among the health professionals is the reason for this difference. Like I said, have a pretty strong feeling about this. By her and the AG issuing this executive order mandating implicit bias training for the healthcare industry, they are simply ignoring the fact that there are other factors at play with this discrepancy. And this is where I really get angry. What she's really saying by this executive order is that racism is the root cause of the difference. And I am highly offended and feel it is completely inappropriate for her to paint me and other healthcare professionals as being racist. Mandating this training as a requirement for licensure should absolutely be discouraged by the MDA. In fact, these types of derisive actions by politicians and grievous hucksters only incite racial polarity and do nothing towards healing any perceived racial disharmony. And I hate to be cynical, but is this executive order just another election year ploy? So I am strongly recommending that the MDA try to discourage this racial or this mandatory bias training. And I'm happy to participate in any committee or give suggestions for why this should be discouraged. That's my feeling on the whole thing.
All right, thank you for your comments. Next, we have Jerry Cohen. He says, for Vince Lizio, any movement on PPP loan forgiveness automatically? No forms to fill out.
Okay, Jerry, nothing, I can't give you anything specific because honestly, a lot of that's federal, and we know where things go with the federal government sometimes, the PPP loans. I know there's talk about it and there's things, but I don't know if anyone else on any other panelists has any other information about anything going on. But I know there's been talk about it, but nothing specific that I can tell.
Vince, I believe the ADA news, e-news came out maybe last week, and there were a couple of senators, I want to say, that put forward a bill on this for under 150,000. I don't know the progress of that bill. Others may, but I know that the ADA did send something out toward that.
Yes, I guess that's probably the question. We are, there is advocacy, obviously, in that regard, very strong.
Thank you. And I have Mark Johnston, more of a comment, says the public is invited to participate in the administrative rules hearing on September 18th at 1 p.m. and it is via Zoom, so you have to drive to Lansing. So for those interested, please participate. And I don't see any other questions or comments. So again, I would like to give my thanks to the panelists for taking their time out, who I think all did an excellent job. I'd like to thank all the attendees for participating in your MDA and for your comments and questions. We look forward to all of them. We represent the diversity of our group. And any questions, please feel free to follow up with your Board of Trustees. We will be putting forward this meeting soon, and we will certainly look forward to presenting comments that we have heard. And please be an active participant with that. I'd like to wish everyone a good evening, and we'll see you next time.